We looked at mechanism of action and PK/PD of aminoglycosides. Now the next learning objective is, given a patient with a suspected gram-negative infection, determine a traditional empiric aminoglycoside maintenance dose and frequency based on population kinetics. Once you assess patient's body weight and creatinine clearance, the next step is to calculate population volume of distribution. And by population, we mean that these numbers are derived from population studies. So these are actually an estimate of what it would be in your patient. Because aminoglycosides are hydrophilic, they distribute primarily in the extracellular fluid. So fluid status is extremely important. In someone with normal fluid status, so in a general population, the estimated volume of distribution is about 0.25 liters per kilogram. Now, if someone is dehydrated, this volume of distribution will be reduced. So for the purpose of this class, we're going to use the number 0.15 liters per kilogram. On the other hand, if someone is overhydrated, the volume of distribution will be increased. So we're going to use 0.35 liters per kilogram in this class. Of course, some reasons for fluid overload is heart failure, peritonitis, edema, ascites in patients with cirrhosis, pregnancy, and cystic fibrosis. You will learn about cirrhosis and ascites in your GI course. Now, of course, because these numbers are liters per kilogram, you have to make sure that you use the right number. So generally speaking, for a normal person, we're going to use ideal body weight. If someone weighs less than their ideal body weight, you should use their actual body weight, which will be the smaller number. And in obese patient, we're going to use adjusted body weight. By now, you know that the PK/PD target for aminoglycosides are peak to MIC ratios and AUC to MIC ratios. For simplicity, we are only going to look at peak to MIC ratios in this class. So the target for peak for severe infections is 8 to 10. For moderate to mild infections is 6 to 8. For urinary tract infections is 4 to 6. And of course, if you use aminoglycoside for synergy in gram-positive organisms, the peak will be 3 to 5. Now, the peak is what tells you the efficacy. So the peak to MIC ratio should be these targets, and that tells you efficacy. We also target trough for safety. So we want to make sure that the trough is also less than 2 for all of these, to make sure that we minimize the risk of nephrotoxicity and ototoxicity. Now, the dosing for tobramycin and gentamicin are identical. So these targets are for both gentamicin and tobramycin. Now, if you happen to be using amikacin, so these are the different targets for amikacin. So once you figure out what you want to target for your patient, next we need to actually calculate elimination constant before we can come up with the dose and frequency. So again, this is an estimate from population. So it's not going to be exactly the same K in your patient, but empirically, estimation is the best thing we can do. So this is the equation we're going to use, which includes creatinine clearance, and that will give you the K for your patient. And once you get your K, you will use this equation to get tau. Tau is frequency. So this is going to tell you how frequently should you give the dose to your patient. And this is based on how the patient is actually able to clear it. So you basically plug in the peak and trough goals. So if this is a severe infection, for peak, you're going to write 10. And then for your trough, you're going to write, let's say 1. So you want it to be less than 2. And then you plug in the K and you solve for tau, and that tau will give you will tell you how frequently you want to dose it. And of course, then we want to round the tau to something realistic. Frequency should be every 24 hours, every 12 hours, every 8 hours, every 6 hours. So those are things that are regular. So you don't want to do something like every 5 hours or every 7 hours. That's going to make the schedule hard to follow, and it's going to make it very difficult for the nurses to administer the drug. So you want to use standardized frequency. So if you get a tau of 5, for example, you want to round it to the closest standard frequency, which would be 6. So once you figure out the tau, after you round it to something realistic, then you're going to use this equation to come up with a dose. So let's say if you found the tau of 5 and rounded it to 6, so you're going to use 6 in this equation. You use the K that you got from up here. You put the target peak that you want. You put the volume of distribution from previous slides and the K again. and here you put the time of infusion. So for simplicity, we're gonna infuse aminoglycosides over 1 hour. So you just plug in 1 here. It is also common to use 30-minute infusion. If you were to use 30-minute infusion, you just have to put 0.5 here, which makes calculations more difficult. It doesn't matter whether you do 30-minute infusion or 1 hour infusion, as long as you get the dose right and the frequency. So I recommend that for making calculations more simple, just use the time of infusion of 1. And when it comes to monitoring, we want to monitor both trough and peak. So the trough, you want to get it within 30 minutes of prior to the 3rd dose. So that's as close as it gets to steady state. So you want to get the level before it gets to, or actually close to the steady state. And then assuming that the level is at goal, you would just want to get the trough every 3 to 5 in most patients with stable renal function. Of course, more frequent monitoring would be required depending on the clinical status and also on renal status. Trough monitoring is for safety, and we do peak monitoring for efficacy. So the peak you want to do at least 30 minutes after the end of the infusion to allow distribution to the tissues. And of course, it's also important to monitor serum creatinine due to nephrotoxicity of aminoglycoside. So in stable renal function, at minimum every 3 days. In someone with unstable renal function, you want to monitor daily.